unemployed pharmacists are marching to the KwaZulu-Natal Health Department headquarters in Pietermaritzburg. They want to hand over a memorandum. They're demanding better job opportunities, as a large number of them are still sitting at home despite being qualified and having completed their mandatory community service. That's almost 2 weeks after unemployed doctors in KwaZulu-Natal held a similar march. Newzroom Afrika's Phila Mthembu is in Pietermaritzburg on that story. Phila, good morning to you. What's happening there?
Good morning to you, Stephen. So right now, the memorandum which is being handed out is about to be received by the health officials. It's also about to be read as a group of unemployed pharmacists actually stand here. So you'll remember that also a week and a half ago, there were doctors which staged the same march and marching to this particular building for the very same reason. So it gives you an idea that the issue of the scarcity of job opportunities within the health department actually affects a broader spectrum. I'm just going to bring in, a representative from the South Africa's Young Pharmacists Association, Luyanda Kumalo, to speak to us and just give us an idea as to why we are here today. I understand several reasons, Luyanda. If you could just take us through some of them.
Thank you so much. Well, the reason we're here is no different to the reasons underlying any other demonstration that we've went to. Basically, it's the rising issue of unemployment where the pharmacists are concerned, especially at a time where there is a clear and severe shortage of not just the pharmacists, but also other healthcare professionals across the public sector. So that's why we are here at the moment struggling against this matter.
So the memorandum is now being handed over. I'm just going to allow my colleague to show you those visuals as the memorandum is also being received and signed, whilst I also continue with my conversation with you, Luyanda. If you could just also detail to us what are these demands, because you've also seen the memorandum.
Thank you so much once again. Well, first and foremost, we are demanding of the government that they should ensure that each and every pharmacist who has completed ComServe finds employment, and this should happen within a very short period of time. Second to that, we want the government to give us a detailed plan to ensure that nothing of this nature happens ever again. So we don't want a case where we have to constantly be striking and protesting in order to ensure that we are employed at the end of our ComServe. So we need a detailed plan that's going to be implemented across the board. And last but not least, we want the government to ensure that once they've satisfied the first two conditions, they must ensure that there's equal redistribution of pharmacists. So for instance, pharmacists should be of an equal number at the clinic and hospital in the villages. It should be as equal as those in the suburban areas as well. So these are our demands in a nutshell.
And also, how long have the pharmacists been unemployed?
It ranges from a wide period. It goes back to 2023 as far as I know. There's a number of pharmacists who completed ComServe at that time, and they are still a part of us protesting at this moment because they have not been able to find employment within the government itself. So it's quite a long period. I think 3 years to be exact.
Have you looked into the private sector?
There's only so much. There's only so much one can do in terms of looking towards the private sector. I think what underlies our logic is that the government, first and foremost, is funding most of the pharmacists through NSFAS when we study. So then we think and we believe that if they know the number of pharmacists to be produced, then equally they should know the number of pharmacists who have to be absorbed within the public sector. If there is a possibility, it's the government as well that should ensure that there is a relationship between themselves and the private sector to ensure that human resources are equally distributed.
And it's also been a long-standing issue, Luyanda. We've also seen doctors demonstrating such marches as well, complaining of the same thing. What makes you think that the situation will change now?
Well, I think it's our drive, really, more than anything. But we also don't believe that this issue is beyond the means of the government. It simply has to be that they rearrange their priorities. In fact, the reason we came here before the budget speech is being canvassed by the President and the Finance Minister is because we want to ensure that the provincial departments, the national DOH, they align there are issues as far as money is concerned with the problems of doctors, pharmacists and other healthcare professionals.
And how long are you giving officials to respond to the memorandum of the grievances that you brought here today?
The guiding theme from other protests has been a minimum of 7 days, so it hasn't changed. We also expect them to respond to us within a 7-day period.
Okay, thank you so much for your time. So the memorandum, as you could see there, Stephen, it's currently being signed. I see from the representatives receiving it, but we also did overhear during that conversation that it's going to be moved forward to the rightful people, and also just 7 days for the officials to actually respond to these unemployed pharmacists. So it is a long-standing issue. They've also been saying that services get to be highly affected when it comes to medical facilities because of the shortage of pharmacists, as well as just health medical staff. There becomes a shortage there, and also the patients get to feel the pinch. They get to bear the brunt of the shortage of the medical practitioners.
Phila, thank you very much indeed on that story for you. And of course, so many times around the country, you see people who should be working, who have qualifications, who should be working, in fact, for government to provide services that you need.